This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
As
Supposed to
second.
help first or
Medical Dilemma.
Hi, I'm Sunny Del Rosario, and you're tuned in to Medical Dilemma. The World Health Organization believes that around 36% of the world's population are at risk of contracting dengue. That's around 2.5 billion people. In the Philippines, the Department of Health reported a 23.5% increase in the number of dengue cases as of September last year. It even expects more cases to be reported in 2016 due to the long dry spell. The shock of dengue, also known as break-bone fever, certainly deserves our immediate attention. For this episode, we have Dr. Pamela Caedo, a pediatrician, Chief of Staff of the Department of Pediatrics and Vice Chair for the Administrative Affairs Department of Pediatrics of the Makati Medical Center and also of St. Luke's Medical Center, Global City. Welcome to the show, Dr. Caedo.
Yes, I'm happy to be here. Good afternoon.
Yes, and thank you for allowing us to have you here. Now, let's first talk about the basics of dengue. Okay? How did dengue as a disease develop? Is this a new disease or is this an old world disease that has resurfaced again?
Well, I would say it has been it is an old world disease, no. But in the Philippines, like in Southeast Asia, it has been properly described in the 1950s. In fact, among the countries in Southeast Asia, it really was first described in the Philippines in the 1950s.
This was in the 1950s.
Yes, in the Philippines.
But this disease in the world dates back to as far as when?
19th, 20th century, earlier.
18th, 19th,
Yes.
19th century,
Yes.
so that early. So I guess this is a resurfacing of an old world disease.
Yes, and of course now we know more about the disease and it's being described, more clearly. It's clearly more understandable for us doctors. And right now, we know more about the disease, and maybe they are describing the same disease as what we've had in the 18th century. It was actually dengue.
Does dengue have different types or strains?
Well, we know that there are four different strains of dengue: DEN1, DEN2, 3, and 4.
Okay, and what are the differences among these strains?
Well, in terms of presentation, they can be the same, but we are not able to identify which of the strains a patient have. In your lifetime, you can be sick with dengue with all those 4 strains.
With all 4 strains?
Yes, supposed to be if you get dengue DNN1, you get immune to that disease. But it's not routine for us to determine what type of dengue you have. What we do is we treat you as overall as a dengue infection.
As a dengue infection.
Yes.
Are there differences among the strains in terms of danger or virulence?
Well, what we know is that in terms of presentation, they may not we were not able to differentiate, as I've said, because we are not able to know which strain a patient has. For example, in a patient who has a mild dengue versus a patient who has a severe dengue, we are not able to determine if it's DNN1, what strain you have. So,
but we do have a test.
But we do it. So it's not routine that we have to determine because, number one, it will not change the management. And there is really no exact clarity yet as to the presentation of the different 4 strains.
How is this test carried out?
Well, blood extractions.
It's a blood test.
Yes,
Okay.
but these are highly specialized tests, and not all centers would have this. In fact,
see.
only special centers would have this test to determine which type of dengue a person has.
And how long does it take to get back the results of the test?
Well, as I've said, it's not routine. So it's really a special facility who will do that. In fact, I'll be honest, in my practice, we have not determined if you have a DEN1 or a DN1, 2, or 3, or 4. What we determine is the clinical course compared to the, of course, the usual laboratory test that we request would be very basic, just a CBC. But now, just the CBC, but now, over the last 3-4 years, there is what we call the Dengue NS1. It's a very special test. Well, most of the centers has this test already. It will determine if you have dengue on day 1. So together, on day 1, together with the CBC, we request for the dengue NS1. So that will be a more I would say, accurate test to determine if at day 1 of fever, do you have dengue or not.
So if I suspect that I have dengue, I can go to a testing center, and at that moment, I can confirm if I do have the disease or not.
Yes, most of the centers, like in the centers that I work at, we have that, dengue NS1.
Okay, and what's the usual management procedure if a patient contracts dengue?
Okay, so we have three ways of managing, of course, a patient with dengue. For example, if you know that a patient has mild dengue, well, with signs of danger already, then for those with mild dengue or early stage, not all of them would actually require admission. It's not automatic na, oh, you have dengue, at day 1 we already know, admit. No, there are cases that they improve even without admission. These are the mild cases of dengue. So the initial management, of course, will be close monitoring, and we just make sure, well, I'm a pediatrician, so I focus on the children. So we make sure that the child is still playful, is still active, is still eating. So what we want to prevent in a patient with dengue is dehydration. Because very, very prominent in dengue patients is that they lost their appetite. Okay. Really, that's at the peak of the fever. So dengue will last for 2 to 7 days. I mean, fever will last for 2 to 7 days. But in between, what is prominent, well, I'm talking about pediatric patients, is that their appetite is really down. So very, very obvious. A parent would notice, Doctora, this child is very playful. On 2nd day of fever, he's just sitting down and doesn't want to even eat. Yeah. So with that alone, there is already an indication to intervene. So
what's the mortality rate for dengue?
Well, for the mortality will come in for the severe cases of dengue. So it will fall about 5 to less than 10% from.
Okay, so 5 to less than 10%.
Yes.
Okay. And are there any particular age ranges that are more prone to, being killed by the disease?
Increased mortality in dengue. Well, it will be the very, very young, of course, because they're easily prone to dehydration, and the very old, I would say. So there's an increased risk for morbidity and mortality in these age groups.
Okay, thank you so much, Dr. Caedo, for basic information about dengue. So we'll have to take a break for a while. Okay, don't leave this channel. We'll be right back after a few words from our sponsors. Okay na ho.
comes out of my mouth, especially in such a place where anything can spread like wildfire.
When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?